Hi, welcome to another in our series of video learning modules with the Mother's Mental Health Toolkit Project. I'm Dr. Joanne McDonald. I'm working with the Mother's Mental Health Project and the Reproductive Mental Health Service at the IWK Health Centre in Dalhousie University in Halifax, Nova Scotia, Canada. We're going to explore the story of one mom and how her experience demonstrates the role that community service providers can have in mothers' mental health. So as a community service providers to mothers and young families, we think there's probably lots of opportunities for you to promote and support mothers' mental health. And you know that a mother's positive mental health promotes the development of her child, both physically, in terms of their learning, a solid self-esteem, confidence, and what's very importantly known as emotional regulation, which sets the stage for successful relationships and function later in life. In this series, Meet Our Mom, the Mother's Mental Health Toolkit Project team will introduce you to case descriptions drawn from the real experiences of our mental health clinicians and our Family Resource Center partner staff. These moms have common presentations and problems that will challenge you to define your possible role and contributions to her well-being. The moms will also provide examples of how you might use the toolkit resources in your work. So it might help to have a copy of the toolkit out for reference as we begin to meet our mom. Or you could also print off this presentation and make notes as you go. So meet our mom, Julie. She's 28 years old and a full-time mother and homemaker, parenting a 6-year-old son and a 4-month-old daughter. This was a planned pregnancy with her new partner. She's living in a rural area and her partner is employed on a large farming operation. The first weeks postpartum were really exciting for her with her new family, and she felt very comfortable with the mothering tasks having parented her 6-year-old. But the past 6 weeks, she feels really, something has changed. Her energy is low and she has no motivation, but she can't identify any particular stresses or worries. She feels tearful and she's not enjoying her usual TV shows with her partner. She's avoiding friends' call and Facebook, which usually she's quite active on, as she's normally quite a social person. She doesn't know what is wrong. She feels somewhat irritable with her partner and notices that she has lower patience with her son's activity level. And she has this odd but very deepening and increasing sense of hopelessness. She finds herself thinking it just doesn't seem worth it, but she can't identify why she's begun to think or feel that way. She is reluctant to tell you, but she mentions that she's very frightened by intrusive images of car accidents or of the baby falling from her arms, and she says it's like she's going about her work in the household and all of a sudden she'll picture what would happen and what would it look like if the baby fell from her arms. She thought the curtain was moving in a rhythm to the radio once, but when she looked again, the curtain seemed still, and twice she heard her name called out when there was no one else in the home. What are 3 possible mental health issues that go through your mind for our mom, Julie? Take a minute to jot them down. Well, the project team identified that Julie has some possible signs of postpartum depression, that particularly she has unexplained low mood, negative thinking that's not characteristic for her, low energy and initiative, but particularly her inability to enjoy herself and her usual activities is considered a hallmark of potential depressive syndromes. She's tearful, as she would say, for no reason, and has unwelcome, if still kind of vague, thoughts about suicide that are not usual for her. And she describes this as sort of these feelings and thoughts come out of nowhere. And when she settles herself, she says, I have a good life. Why would I, want to harm myself, or why would I think about not being here? It's very strange to her. And that in itself is something we pay attention to. The curtain moving and the name called out seem to occur as well without any other trigger. They could be early sensory changes and are a soft warning sign sometimes for psychosis, but really only clearly psychotic phenomenon if they progress and the thinking itself becomes more distorted, less logical, or that she has very bizarre or unusual ideas or beliefs. So many of us can have what we call an illusion, which is something that we think we see something moving or we hear a sound that's not really there. Again, unless it's persistent and progressive in the sense of getting worse or more frequent, and severe in terms of the nature or the content of it or how it begins to affect feelings and thinking, it's not always a sign of illness. The sudden and frightening ideas or images of harm could be obsessional symptoms, which themselves can be a feature of major depression as it progresses, or it could be a sign of a primary anxiety disorder called obsessive compulsive disorder. Both can be new diagnoses in the postpartum period. Obsessions generally are thoughts, images, or sensations that feel forced, not welcome, and they're far from the usual ideas or intent of this woman. So there's usually a sense that they're not comfortable. In fact, they can be very uncomfortable, unusual, and sometimes are confused by people wondering, is this a possible hallucination or a sign of psychosis? But usually it's that the person would say, it's like all of a sudden I'm watching a movie, but I know that it's not real, but it's like suddenly in my mind's eye I see this, or suddenly I have this train of thinking, or suddenly I have this sensation in my body that can't go away. What would you like to know more about with this mom, given the history that you have so far? Let's take a second and think about what would help you in working with her. Well, the toolkit team wondered about one, has Julie ever experienced these kinds of feelings and thoughts before? She recalls a similar period of low mood, lack of energy, concentration, and initiative, and this kind of passive suicidal thinking without any true intention to harm herself in the fall about 10 years ago. Her mother had died, though, just 6 months before the symptoms began, and Julie had thought she was just beginning to adjust to her loss. She thinks that maybe the family doctor at the time back home put her on some kind of medication, and the symptoms resolved, and she's gone on to have none of those problems in the 10 years since. We also wondered, is there any family history of post-baby mental health problems or mental illness in general? Is it possible this is something that, Julie and her family are prone to? Well, she tells us that she doesn't know her father's side of the family very well. She asks more, though, and finds out that her father's mother had very changeable moods with highs and lows. And she wonders by the family's description if she may have had an undiagnosed bipolar disorder or some other kind of mood disorder. But really there's no formal diagnosis, so it's a question mark, but not a for sure kind of genetic risk. Her maternal aunt, her mother's aunt, and a maternal cousin, though, both have suffered from repeated depressive episodes. Our last question in our mind was, what was Julie's experience like after her son was born 6 years ago? Julie says actually she remembered feeling very well physically and emotionally after Josh was born, even though his father was always out with friends, had a gambling problem, and didn't seem interested in the baby at all. So she's a bit confused because she's very happy with her new partner, surprised by how hands-on he wants to be with both children, and she keeps saying she has to shake this thing I'm feeling because she doesn't feel like her usual self. And she can see that really her new life with her new partner should be hopeful and is really going quite well. So her feelings and her thoughts are not matching up to her sense of her own reality. What could be the role for you and your organization in her mental health as a mother? Let's think about this. Well, possible roles and contributions are that she has talked about some very troubling thoughts and feelings with you. This suggests a low sense of stigma for the mother and can encourage disclosure of other problems. So she already is a person with some insight. She can look at the past, look in a balanced way with her, sort of long periods of good function. Lots to work with here. Secondly, community awareness and screening for postpartum mental health depression problems are key to early diagnosis, treatment, and recovery. And your knowledge coming out of this training can be very helpful in not being frightened by what she's telling you, understanding that there's no clear diagnosis or risk for her, but certainly there are some signs that she's right to pay attention to, and that you would want to help encourage her into sort of assessment and possible intervention. The knowledge that obsessional thoughts can be experienced with depression and are not typically signs of psychosis can help you educate and calm the mother who experiences them. There are effective treatments for these symptoms, both medications and psychotherapy oriented. How might you use the toolkit resource, though, with Julie? Well, the first step is to help Julie recognize she's an experienced mother, and so her overwhelming fatigue and confusion, a lack of enjoyment with her new baby girl, are atypical for her. She does need screening for postpartum mood disorder. Pages 138 and 140 explain and give an example of a screening tool used with new mothers. Julie's confused by how much she's struggling after this baby and not after her son was born, when her life in general was much more stressful. So page 115 to 117 include a section called The Three Parts of Us All. It helps any woman understand how family history, our sense of self, and our social experiences can increase or decrease the risk of a mental health problem. Sorry, I went a little fast there. Psychological factors, and then social factors. How would I recognize the early signs of a postpartum psychosis? Some community service providers will ask. Well, psychosis, first of all, it's important to understand, is a term that refers generally to a loss of a sense of reality in what a person sees, feels, hears, or thinks. It is generally a brain illness, and if thinking and impulses are very unusual or involve harm to herself or her children, this may be a true medical emergency. You may want to have the numbers of emergency services in your area already prepared. It's not a common problem, postpartum psychosis. It occurs in about 1 in 1,000 new mothers, but can be a sort of rapidly developing illness, and certainly a serious illness that bodes the need for urgent medical attention, even if it's from the local practitioner or nursing resource, to sort of get that woman into sort of the proper level of assessment and treatment. I think having some knowledge that there exists the reality of postpartum psychosis for any woman will help staff be less frightened by the possibility and create an openness around that as part of the spectrum of mental health problems. So pages 124 and 125 contain descriptions of postpartum psychosis to help you understand what that might look like. And page 156 shows one example of a map of local services you might need to support any woman with an emerging and more urgent mental illness. So what are some key points when you're working with postpartum depression? Well, remember that at least 1 in 10 women who give birth will present with a postpartum depression of moderate severity affecting daily function. Like Julie, though, they may not experience this with every pregnancy. It's also key to understand that the symptoms you think might be depression are usual for this mom or new, getting worse, or not explainable by her current stressors. Recovery can be very good with treatment for over 80% of women with postpartum depression. They shouldn't delay assessment, support, and treatment. With any medical problem, there's always a smaller percentage of people who go on to have recurrent problems or more chronic problems, but this is not typical for mood to problems that occur in the postpartum period. So it's a very hopeful area in which to encourage women to seek assessment and treatment. Some other resources for you would be motherrisk.org is a Canadian website through our Sick Kids Hospital in Toronto that provides up-to-date information on the safety of all kinds of medications in pregnancy and breastfeeding, not just psychiatric or mental health medications. And they also have a call-in line. And both professionals and members of the public, the moms themselves, can access this resource. Another interesting resource would be Down Came the Rain, and this is the autobiography of the actress Brooke Shields, written a number of years ago. It's really a very brave and accurate description of the experience of a more severe depression with some of these early, possibly milder psychotic symptoms, but is a very hopeful story because of her full recovery and her willingness to share her story in a spirit of advocacy. Thanks for your interest in our Meet Our Moms series and in maternal mental health support work in your community.